The wound has not healed yet, and Idriso is still in pain. His worst pain, however, is in how he is going to live the rest of his life with a disability.
I feel sad because now I don't know whether I'm going to have like artificial leg to walk like a normal, or I'm going to use crutches. And I feel sad because I can't do other things like I'm doing before. But because I lost my leg, and I'm always thinking, oh Charlie, how am I going to do like that? So I always feel sad, but I keep it.
Inside this ward are a number of other young men. Most of them have been here for more than the 21 days patients usually spend here, though some of them are fit to go home. They are stuck because they cannot pay their bills. The nurse manager here, Rose Buahin, points to a number of such patients.
Since I came here, the least bill that I've seen is about 5,000 Ghana cedis. And it's not easy for them at all. Most of the men here, they don't have health insurance. Most of them, when you ask, they say, oh, me, I'm fit, I don't get sick, so what's the need for health insurance? So when they find themselves here, then they realize that it's better to have the health insurance.
Well, those are excerpts from our recent documentary of and it shows you the people living with the pain of road accident. As nearly 800 Ghanaians die in the country in 90 days, many more people have to live with serious injuries and disabilities for life. Many of those people have to be treated in the country's hospitals, putting pressure on the limited resources available. Well, the Ghana Health Service says road crashes remain a major challenge to the service. Joining us on Zoom is Dr. Samuel Kaba Akoria. He's the Director, Institutional Care Division of the Ghana Health Service. Hello, Doc. Good afternoon. Okay, I hear you now. Yes.
Can you hear me now?
I do hear you now, Doc. So for you at the Ghana...
to you and to all your listeners.
Thank you. For you at the Ghana Health Service, how significant would you say road accidents are when it comes to the limitations that it places on your ability to deliver quality health service?
All right. Thanks so very much. I think this is one big important issue that you are bringing out today. Road traffic accidents have become a silent killer of many citizens and major cause of disability, especially the children, the youth, and persons of middle age in Ghana. Road traffic accidents now constitute among the first 10 causes of sickness in Ghana, and specifically in the third place when you add it to other non-communicable diseases. I'll give you an example. From January to October just 2020, statistics prove that we experienced about 12,100 RTA, road traffic accidents, with involvement of about 20,400 vehicles. And out of that, we had 2,080 people injured with various degrees from mild to moderate to severe, right? And over the years, we have noticed a gradual increase, and we've noticed that most people are dying out of road traffic accidents. And worldwide, it is estimated that it consumes about 3% of country's GDP. And in Ghana, we have estimated that it consumes about 1.6% of our GDP. That translates to about $160 million annually. We are losing just on road traffic accidents. So when you look at these statistics, you will understand the economic and human resource and social impact of road traffic accidents on the health and on the country system as a whole. For instance, we usually say that the children and the youth are the future of this country. That is true, but we are losing our children and the youth through road traffic accidents. So that definitely leads to kind of retard our country's development, and it's an issue we need to start looking at, because the next probably minister or president of this country could die through road traffic accident as a youth who is coming up, and we will be losing a significant person. So I think it's very important to look at it. Thank you.
Let's try and link it directly to how it impedes your ability to provide healthcare for people. So we've had the Ghana Health the Medical Association indicates that there are times when you actually need a bed to take care of somebody else, but it's taken over by accident victims or by accident patients. I mean, do the linkage for us and make it a bit clearer for us.
All right. So thank you so very much. Let me outline some few things point by point so that you and I and people listening to us will understand. There is a huge pressure on us when it comes to road traffic accident. The first one is infrastructure. Now, if you even look, National Road Safety Commission, they are building they're putting some health posts along highways with possibility of high road traffic accidents. That is infrastructure need. Ghana Health Service is assisting with human resource. We are building hospitals because of these occurrences. Now, if you build a hospital, now you have to equip it. And the kind of equipment you need for road traffic accident patient is not just any kind of ordinary bed. Beds that are used in intensive care unit, one sometimes goes for almost $30,000 per bed. Ventilators, we need CT scan, MRI, machines, very expensive to be able to do all the necessary tests they will deserve as patients. Then you move to logistics, blood supply. Every day we talk about lack of blood in our system. People who are involved in road traffic accident, there is always a high demand for blood for them. Then you go to the gloves, because they are bleeding, you change your gloves frequently, syringes, medications, very expensive. When you come to specialties like neurosurgery and orthopedic surgery, when they lose or break their limbs, you need to put some implants. Those implants are very expensive. Then you come to the human resource itself, where you're talking about the various kind of medical personnel we need. So you need neurosurgeons, you need plastic surgeons, you need intensive care specialists. And let me tell you something. When you get a critical patient in an intensive care ward, you need one nurse per patient. So 3 nurses in a day, just for one patient. Multiply that by the number of patients you might be having. And you see the number of people we need to be able to take care of these accidented people, whom if we have some kind of level of personal responsibility, we could have reduced about 80% of that. Now, moving from human resource, we talk about transport. When you talk about road traffic accident and you talk about its management, you've got to look at it holistically. So you have the pre-hospital services, the volunteers, the community level, and then the emergency medical service that in Ghana we call ambulance service. You've got to provide ambulances with well-trained people. All this is a lot of money that we pour into that. Then you come to the treatment itself. I've spoken of the implant, and you find out that most of the time, these patients, they stay for a longer period of time than any other person. They put stress on the health staff, depending on the time it occurs. I get called around 10 p.m. to come to Rich Hospital, for instance, because of accidents. And then you leave the theater around 1 a.m., then you drive home. That is the implication. You know, then when you move from just the treatment, let's take, for instance, when now they need recovery, rehabilitation. Now you need physiotherapists, you need occupational therapists. Then we also provide what we call assistive devices. If you lose your limb, we need to give you prostheses. Below the knee amputation, for instance, it goes for about $10,000, just for you to have an idea. And government produces this at the Limb Fitting Center in the Ghana Health Service headquarters and subsidizes it for the patient. And that is a whole lot of money that we input there. Then you have people who become vegetative, and we are talking about palliative care. So they stay in the hospital for a long time, they develop bed sores, and treatment of infection is a very big issue, because then you need antibiotics that are very expensive, and these patients, most of the time, they cannot afford. If you take Meronin, for instance, you're talking about spending about 1,000 Ghana cedis in a day just on antibiotics. And as is well said, sometimes they do not even have health insurance. Then you move from there, you look at the psychological impact for the family, for the health staff, and for the patient himself. So, for instance, then you are talking about, if the person is a health staff, there's lots of productivity, or any kind of worker is a young person going to work now, he loses his job, no productivity, is in the hospital, family have to rearrange their schedule to visit, take care of the patient, and just imagine if that person is the breadwinner of a family. it's a huge disaster because
Right.
then he loses his job, then the family, his school fees and other things cannot be catered for. So these are the direct impact that we do have, and I think people will start to appreciate if you continue this good work you are doing by
Yeah.
making it.
Yeah,
putting it out there.
I mean, this afternoon I've been able to appreciate the statistical breakdown that you've given us, Doc. Let's wrap this up with how you think, and maybe let's paint it a bit clearer. It is clear indeed, I think, but let's break it down further, if you may, to our viewers. How will the reduction in road traffic accident benefit the other part of our healthcare system?
All right. So, for instance, I just outlined that we're spending about $165 million just on road traffic accident issues. Okay. If we had that money, if we are able through preventive and promotive activities to prevent about 80% of our accidents, and that money is geared towards other issues of the health system, let's say maternal and child health, we would have been covering a whole lot and would have improved the quality of services. If we look at you just spoke about the bed availability, the syndrome of no bed we had. I'll come to that in a while when it has to do with some of the issues, some of the measures we've put in place to make sure that no patient gets turned away. But now, an accidented patient who stays in a hospital for 1 month will now take that bed, which could have been given to another patient, and we want to even make the turnaround time for our hospitals very quick. But with accident patients, you cannot do that. They stay as long as they have to stay. And we make sure they stay for that time to take good care of them. And if they develop infection, it's even worse. So if we are able to cut down road traffic accidents, then actually we would have been saving a lot of money in providing potable water in all our health facilities, in putting up infrastructure, more infrastructure, bringing up equipment for infection prevention and control. We would have been able to procure more items towards improving other sectors of our health service.
I know this is totally, well, maybe not totally, but somehow out of your league. But is there anything that the Ghana Health Service intends to do when it comes to the reduction of these accidents on our roads? Is there a plan like this?
Yeah, realistically, we've been doing. It's not that we want to do. We've been doing since the establishment of the Ghana Health Service, and we keep intensifying it. Let me start by even outlining that accident and emergencies are part of the 6 indicators of the sector-wide approach to health. And when you come to clinical service delivery, it's number 1 in priority on our list. So in 2011, we developed the Ministry of Health Accident and Emergency Policy guideline, and we are implementing it to the letter. And the first thing we are doing, all regional hospitals and all district hospitals, they do have functional 24-hour emergency service, which means that no patient can be turned away without at least receiving first aid. If you do remember, we had the syndrome of no bed, which also helped us actually address and strengthen some of these issues. So any patient who gets to the hospital, any Ghana Health Service facility, at least you get the first aid. The next thing is that you don't have to be the one struggling to get to the next level of care. It is the hospital that organizes and coordinates and makes sure that you get referred. And then they make sure that you get an ambulance and you get appropriately referred to the next level. The next thing we are doing is to come together with other stakeholders like Road Traffic Commission and Road Safety Commission, the MTTU of the police, the National Ambulance Service, to come together to look at how best we can comprehensively tackle these issues of road traffic accidents. Our health promotion unit is also coming out with preventive adverts on how best we can tackle this issue. We have actually gone ahead to strengthen our referral system so that when people get accidents, they move smoothly from one level to the next. We've gone ahead to even sign some MOUs with other agencies like CHAG so that there will be a similar service delivery and the private sector. So patients can easily be transferred from one facility to the next so that there wouldn't be any challenges and burden to the patient and family, but rather is the health system that should be looking at it comprehensively to make sure that these things happen. So we are actually doing a lot when it comes to road traffic accidents, and we are making sure that every health facility has a triage area where when you come in as an accident patient, you get triaged and you get resuscitated immediately. We have within those setup, we got all the necessary drugs that you need within the first 24 hours. And nobody even would ask you for health insurance or not, because by law, by rule we've put is that the first 24 hours, any individual who gets into our health facility should have that attention until his relatives come after 48 hours when the patient is recovered. We wouldn't ask you bring money before we treat you. You get treated before we even talk of anything about money. So these are things we are doing and we'll keep doing, keep perfecting it as much as possible within our possible means. Yeah.
I really enjoyed this conversation. It gives me a very clear, very clear picture of just what we're losing and just what burden we're putting on our health systems by sometimes our own carelessness on the road. Doc, thank you so much for your time. That's a doc.
Let me just, if you could allow me, I'll just say this.
Please go ahead.
Yeah, government is doing so much to support the care of the patient. But one thing we have realized is that we are lacking that individual responsibility and collective responsibility. Government cannot do it all. It is left to us as citizens to understand that when you drink and drive, you get an accident. If you are in a throttle and they are over speeding and you don't tell the driver, you don't call the driver's attention, when he gets an accident, you die. It is our responsibility as individual citizens to understand that you need to get the appropriate driving license. But you just don't get because you buy a car, you can purchase a car, you get a license from ABNC or you don't have any and you just start driving. We have come to realize that anytime there is a new road constructed, people just drive anyhow, they overspeed. And you find out that you have more accidents on our paved road than those that are not. It is not a reason not to pave our road. We got to do that. But when we do that, when things are put in place, then we have to also be responsible. Yeah. I don't think the preventive is far better than curative, because I operate on road traffic accidents. Just last 2 weeks, I did the same. People who break their necks and they cannot move their limbs. Young people. Motorcycles, you see, they overtake the red light. Nobody says nothing. They get hit down. And then they come to the hospital. They can't afford x-ray. They can't afford surgical implants. And it is causing us a burden. And that individual responsibility and collective responsibility is something I want to highlight. Right. And private sector involvement is also good. And one very important thing is for you, the media, we plead with you to give more time into road traffic accident campaign. Unfortunately, COVID-19 derailed delayed most of our intention when it comes to emergencies service on road traffic accident. But we're coming back to them, and we'll need your support to do all year round campaign against road traffic accident. We will be reducing about 80% of the accidents. Our children will live longer, our youth will live longer, and we'll have a better country. Thank you.
Hopefully. Doc, thank you very much. That's Dr. Samuel Akorie Akaba there. He's the Director of Institutional Care Division of the Ghana Health Service there. Thoroughly put together information now. So you know that we're losing about $165 million because of accidents. And if we can be a little more responsible on our roads, a little more defensive in our driving, perhaps we can stop some of these things.